Welcome to Akhand Yoga, the first institute of impeccable wisdom. Karma Indriya, the motor action, nerves and tracts. Divyank, the walking, talking encyclopedia. My mission, the impeccable wisdom, knowing which everything is fully known. My greatest discovery, Divyank, the divine design of nature, with which the perfect objects are designed and created. Divyank, the reward of 60 years of integrated education. The descending pyramidal tract, as we see in the books from school, college to the university. This particular picture taken from internet is one of the best pictures, I can say, detailed. There are certain things in this picture which are normally not found in other representations of pyramidal tract or descending pyramidal tract. But there are certain things which are highlighted here. There are certain things which are not been highlighted, which I would be explaining later. But let me first explain this, what is known in this particular picture. As you see right on top, there are fan type of fibers which originate from neocortex or the cortex, and it is marked as a motor area of cortex. Then their fibers are coming down, merging it like a fan in one place, which they call it internal capsule. In internal capsule, you can find these fibers are set into two separate ones. One goes to geniculate fibers. They go to brainstem, midbrain, pons, and medulla. And these fibers are responsible for cranial motor nerves. And fibers which come down to medulla oblongata, there is decussation of pyramidal tract. That means fibers are crossing over to the opposite side. What is the percentage which is crossing over has not been marked here. We will be discussing that. But there are also the fibers which continue to go down on the same side. And then they also come out to the opposite side when they have to take action. So let me start again. Motor cortex area, fibers coming down to internal capsule, geniculate fibers going to midbrain for cranial nerves, other fibers coming down, maximum of them crossing over to the opposite side in medulla oblongata, remaining continue, and the fibers from there give rise to spinal nerves. I'm sure this is so. You can definitely say Karma Indriya mean actions, motor actions, cranial nerves as well as spinal nerves, and the pyramidal tract and nerves. As I have already told you, nerves or nervous tissue inside the central nervous system is called tract, and in the peripheral nervous system they are called nerves. Now let's start the journey with a crystal clear wisdom so that we understand how Karma Indriya function to execute all the functions so that we are perfectly healthy. At this juncture in the brain, we can call it there are three different centers which are important for motor activity. One on top I have shown as a primary motor cortex, premotor cortex and primary motor cortex, and motor cortex, they constitute 61.803% of the nerve fibers which are responsible for execution of motor activity. At the same time, 38.1966% of fibers originate from somatosensory parietal cortex, which carry the information from the body for which the action have to be taken. So I'm making one thing very clear, without having sensory component, motor action cannot do. So one component, all the somatosensory fibers from the entire body, like a reflex arch, come to somatosensory parietal nerve, and 38.1% of the fibers are from there, whereas 61.8034 are the motor, and they form the descending tract. Second part which I have talked about is basal ganglion. The picture you can see is a part of the limbic system, you can call it. The objective of basal ganglion is programming and planning of the motor activity. Karma Indriya's planning and programming is done by the basal ganglion. But let me also tell you, this ganglion is a misnomer. There is not a ganglion in basal ganglion. It's only a collection of neuron cells, gray matter, which takes the action there of thought, planning and execution, not as a ganglion, as a neuron independent. Thought process starts there, and execution is done by motor cortex. Now these two, then the fibers come down and they get associated with cerebellum, and cerebellum is responsible for coordination of the movements. So whenever we are learning to do integrated work, all these three components of the central nervous system of the brain should work in unison with each other, so that we learn the art of Karma Yoga or Karma Indriya fully. Like for example, as I told you earlier also, when we are learning to driving, it's very difficult. But once cerebellum is able to coordinate between the basal ganglion thoughts, motor execution and this, then driving becomes almost a spontaneous thing. And that is what I'm talking about. Karma Indriya should give you information completely like this. Once you learn and memory is put into the synapses of this particular system in the brain, then you will never forget the rest of your life. And the whole idea of bringing Gyan Yoga, Gyan Indriya, then Karma Indriya, so that we can use different processes to integrate the entire nervous system and also activate the outer three layers of neocortex. Third, second and first layers, so that we can be in tune with the universal consciousness. How I have done it, I'm going to explain as we proceed. So at this juncture, we can say brain has got three centers which are responsible for programming and planning, execution and coordination. And then these fibers come down. So this is what is happening in the brain. Now, as this particular picture, you already seen the descending tracts. There are left side, there are only two, lateral and anterior. And ascending, there are three, anterior, lateral and posterior. We have already talked about the sensory component. Now, motor component is only two. So this 2 into 3 ratio is also the Wink ratio. Now let's understand the whole pathway much more clearly. Descending pyramidal tract has got 10 stages on both the sides. Number 1 is 38.9166% nerve fibers from sensory cortex or somatosensory cortex or the parietal cortex, which brings the information. What kind of actions have you taken from the body? Body gives you the information, and what has to be done is done in the brain. So nerve fibers which are responsible for sensory cortex are 38.9%. 61.8034% fibers are motor cortex, and this is Deviank ratio. Some people might like to disagree, but I have tried to bring it clear. This is nature design. Nobody has calculated. I'm bringing the nature design. This could be the most possible perfect design. After these fibers come down, then you have corona radiata, fan-like structure, as you have seen in the picture. This is almost the same picture which is used in the beginning. Now in corona radiata, they are merging together. After that, 4th, 7th, they go to internal capsule, marked 4. You can see here. One is the sensory, which is on the left side. two in the medial side, which is motor, the internal capsule, and after that is go to cortex or allocortex, fibers coming down. After that, the fibers come down to midbrain, from which cranial nerves 3 and 4 arise. Some people might be wondering, cranial 3 is oculomotor, which is a cranial parasympathetic. No, there is also oculomotor nerve, which is motor in action, which is responsible for contraction of medial rectum muscles for accommodation reflex, and with help of accommodation reflex, we can learn to activate all the muscles of the eyes and the frontal head to activate strong, so that motor cortex of the frontal lobe signals can reach right up to the third, second, and first layers of neocortex and activate, and we can produce alpha frequency there also with eyes open, eyes closed, provided we can master the art of this particular pathway, sensory to Karma Indriya. If Karma Indriya, this part is really exercised beautifully, you can produce alpha frequency in frontal cortex. Pons has a cranial nerve 6. Medulla oblongata, the cranial nerve 12. I'm sure you must have noticed there are only 4 cranial motor nerves, and there are 4 cranial parasympathetic nerves, and there are 4 pure sensory nerves. What a design! 12 pairs divided into 3 components: sensory 4, motor 4, and then you have autonomic or cranial parasympathetic 4. Cranial parasympathetic, oculomotor, facial, glossopharyngeal, and vagus. Now, coming to 9th level, now I'm being very clear. Approximately 80% of the fibers cross over and descend in the lateral corticospinal tract. Very clear. 80% in medulla oblongata cross over to the opposite side, and they descend down in lateral corticospinal tract. You can see down the red big area on the left side. It's in the almost middle. And these are responsible for primitive movements. With that means those movements of standing equilibrium, which is common between 4-legged animals and human beings. This is also one of the factors to prove that we have evolved. Now 10th level, 20% fiber descend on the same side via anterior corticospinal tract, and they cross over to the opposite side when they have to come out to produce corresponding nerves, spinal nerves. And these fibers are responsible for dexterous movements. That means all those specialized movements of the hand and eyes and others, which are responsible for very specialized kind of movements, which are normally not found in lower animals. And I'm sure if all these fibers, 80 plus 20%, and all the muscles connected with it are exercised fully and made the sensory component strong and then motor component equally strong, I'm going to talk about how we can do it. I can tell you we can activate outer 3 layers of neocortex throughout the brain, and that is exactly what I've done, and that's how. I'm just sharing with my experience how did I do it. And I'm sure now that I have done it, I'm sure everyone very safely and effectively with awareness can do it. But I request all of them first to understand my theoretical knowledge which I am giving, and with that only step by step do it. Don't follow something which is not here. Proper theoretical knowledge is absolutely essential for practical. I know a lot of people who learn for yoga and other things are suffering from psychosomatic disorders because they don't understand the practical theoretical knowledge and then do the practice with awareness, and they do certain things prematurely, accidentally, otherwise which create more problem. I do not want anybody to suffer. That's the reason I'm trying to share my experience with the scientific knowledge so people can enjoy this journey of Akhand Yoga effectively. And this. From now, we are very clear what are the 10 stages of descending pyramidal tract. Karma Indriya. So now let's go to the next. Now you have two different types of fibers. Upper motor neuron fibers and lower motor neuron fibers. I've used the word upper motor and lower motor. Now, same picture, you can see internal capsule, right from neocortex, right up to anterior horn cells in the spinal cord. All those fibers are called upper motor neurons, and they are the descending tracts. Fibers inside the central nervous system or upper motor neuron are descending tracts. They are not nerves. And lower motor neurons are the one which start from anterior horn cells and appear as spinal nerves to supply different muscles. So hope this particular picture is very clear. Upper motor neurons are tracts inside the central nervous system, and lower motor neurons are the one which arise from anterior horn cells and work as nerves. To make that particular thing understand very clearly, pyramidal tract, upper motor neurons, as you have seen, are marked with a lateral corticospinal tract and anterior corticospinal tract. There are only two. 80% fibers go to lateral corticospinal tract and then anterior 20%. And I have shown gray matter inside the middle, which is there, and then anterior horn cell as well as posterior. Posterior is responsible for sensory. From anterior horn cells are the lower motor neuron which arise. So I think it's very clear pathway. So if you understood very clearly and you can bring your awareness to the brain and the nervous system very clearly, you can activate every part of the nervous system. 100 billion neuron cells and memory of 20,000 per neuron cell. And if you can really do and activate, integrate with the entire nervous system, and that is what Karma Yoga is all about. That's why Karma Yoga plays very important role in Akhand Yoga. This particular picture, I have already explained, I'm not going to explain, that there is a neuromuscular junctions. The nerves which come from anterior horn cells, and when they can, next message they give it to the muscles. That junction is called neuromuscular junctions. This nerve, motor nerves, then junction and the muscles. And please go back and understand the 10 steps so that you can understand how transition of the motor signal from the motor nerve, our Karma Indriya, is transmitted to the muscle for their further action, and how we can use this particular knowledge to make a real difference to our integrated health. Now come to the question. There are three different types of muscles which nature has. The one is called skeletal muscles, and these muscles by and large are what responsible for all the muscles which we can see. And to activate these muscles, the best exercise is aerobic exercises only. During aerobic exercises, oxygen is used, and let me tell you, up to 61.8% of oxygen is used for aerobic. Very moment we start using more than 61.8034% of oxygen, shift is already goes to anaerobic type. So if you avoid going to that, fine. Even if you do it, doesn't really matter. But by having aerobic exercises, maybe also anaerobic exercises, if you can increase the energy level within the muscles and make them so powerful, so as they do in peripherally, they get exhibited in Brain also. Motor cortex as the sensory cortex. As a result, third, second, and first layer of neocortex can also get activated, and they can increase the blood supply. And alpha frequency is nothing but better perfusion of the outer three layers of neurocortex. Once their blood flow increases, because the activity at the peripheral skeletal muscles can also represent there. This is one thing which I've used it to activate entire nervous system. Now, as for skeletal muscle concerned, aerobic axis primarily, but anaerobic also would help at the same time. Smooth muscles, like eyes accommodation, blood vessels, lymph nodes. Once you can also consciously contract these involuntary muscles within the body with the help of chakral yoga. Chakral yoga can help these smooth muscles much better. This is an art which I have learnt on my own. And with that, I've been able to control almost all the vital organs which are normally not possible for people to do because they're involuntary. Once you are able to bring involuntary also under voluntary control of the smooth muscles and the cardiac muscles, you literally are the masters of the human body, are conscious. Now, smooth muscles energy is more than what you find in skeletal muscle. If skeletal muscle produce one, smooth muscle would produce 1.618034. But cardiac muscles have energy 2.618034 times because they act also like skeletal muscle as well as involuntary muscles, and they with that the cardiac muscles with good aerobic exercises, if you can make the heart pump clearly fast, and also maybe good pranayam which you can like ECP, external enhanced cardiac pulsations, or Bhastrika, you can increase the blood pressure back to the heart and activate the heart muscles much better. If you can safely do that with the help of different kinds of pranayam, different kinds of exercises, I can tell you the entire neocortex throughout the brain, you can integrate, activate, awaken, and make optimum use and make your entire nervous system as one in antenna for Akash-Kosh. And now I have explained how I have used Gyan Yoga to understand the concept and information to be carried, and how I have activated other sides which are normally not done with the help of Akhand Yoga. I improved the quality of actions, optimized actions of skeletal muscles, smooth muscles, and cardiac muscles, and thereby entire system was done. In this yogasanas, pranayam, tratakam, and some other exercises which center around muscles and Karma Indriya would make a lot of difference. So I think I've given a very brief introduction to Karma Indriya, Jnana Indriya, how the Jnana Indriya can bring the information. If the power is there, thereby the Karma Indriya action will also be probably. It's like Newton's law to each and equal and opposite reactions. More powerful the sensory stimulus, more powerful threshold value, more powerful the action potential, and same action potential can be carried to the motor side to produce the kind of results which are required to make optimum use of the human body in complete. And that is the beauty of Akhand Yoga. And 10 stages, particularly yogasanas, pranayam, meditation, tratakam, play a very important role to activate the outer three layers of neocortex of the entire brain. But please do with awareness. Don't jump without understanding that. And learn to do step by step on your own. This is something you'll have to learn on your own. You can learn because nobody else other than me has an experience, and I don't think I can myself do it for everyone. So I can only share my experience. Now you do with awareness and be happy with it. Now there is one thing which I want to bring for the first time. I bring a clinical picture into this to prove what is upper motor neuron and lower motor neuron disease. In upper motor neuron disease, that Karma Indriya, starting from neocortex right up to anterior horn cells, are can produce. The left side of the brain controls the right side of the body, and right side of the brain controls the left side of the body. If there is a cerebral stroke in the brain, I'm talking about now, I'm sticking only to the brain. I do not want any injury otherwise. Let's not go into that detail. Cerebral vascular attack or accident in the brain, either with a clot or hemorrhage, can produce hemiplegia on opposite side. Whereas poliomyelitis affects the anterior horn cells, as a result, the nerves get affected. Now, since the nerves get affected, all the muscles associated with particular nerve, brachial plexus as well as lower legs, get reduced or degenerate, and as a result, you can't do anything about it because reflex arch, segmental reflex arch in poliomyelitis is affected completely. Whereas all the segmental reflexes in upper neurons, particularly the brain, are unaffected. As a result, patients suffering from upper motor neuron disease because of accident in the brain can improve their lot with a physiotherapy by improving the quality of segmental reflexes. So I'm sure that this particular knowledge will be beneficial for the people who unfortunately have suffered either from poliomyelitis or from upper motor neurons of cerebrospinal paralysis. And I'm sure we can do quite a lot, except maybe few things where, like speech, may be a little difficult. But I'm sure speech also we might be able to learn to improve with the training. I wish I was a doctor when my father had a paralytic. It was when his left side got affected and speech was also affected. Had it been there, and I'm sure I would have been able to help him. But I'm not going to get into clinical practice once again. Now I would concentrate on this. So please, I request, and I know what to bring me back to clinical medicine. I have given the knowledge. You can, with that knowledge, you can definitely learn and bring the change yourself. I want every patient to become their own doctors and be healthy, wealthy, wise, and happy. With that, let's come. And this particular site, I think almost everything which I've been talking about finally is explained in this particular thing. But at this juncture, I'm not going to talk much about this at this juncture. I would say it has been lovely sharing all my experience of Akhand Yoga, which has helped me to activate the outer three layers of the entire nervous system, activate all the 100 billion neurons, and create a memory through education of 20,000 memory synapses into that. As a result, I literally, everything which I'm talking about is extempo. It's nothing from any written script I'm talking about. My experiences I'm explaining as I had experience and done with it. And with that, I would say thank you very much for kind listening. And I'm happy that I'm sharing and enjoying it. Thank you well again.